So, Namaskar everyone. My name is Dr. Manish Yadav, and I have come here to share with you some insights regarding a topic, a question rather. There's one question that a lot of homeopaths struggle with, especially in the initial practice. Of course, when they become little senior, 10 years, 15 years, 20 years, then they know the reality in the practical experience, like what happens in practice. So they are less rigid and they become flexible. But when you start your practice in the beginning, and also many times this question remains even after long years of practice also. The question is, do I need to really find out the constitutional remedy for the patient? This word, constitutional remedy, it created a lot of confusion around homeopath. There are systems, there are people advocating it. There are people who don't advocate it. Like, you'll find some group of homeopaths who just stick to this idea of constitutional remedy, finding constitutional drug, and there are some group of homeopaths which are completely opposite to this. So what is this constitutional drug and what is this constitutional remedy, and can we cure even without constitutional remedy? That is a question that comes along. So I'm not an expert to talk about. I'm not an expert on philosophy and organon. So whatever I'm going to share to you is not that I'm the authority about this, but I'm going to share you my experience, what I have understood, and what is my learning behind this, and how I have also fought with this question for long years, and now what answers I have got in my clinical practice. Because battling this question, it creates so much confusion and low confidence in practice. So I will share you one quote from Clark, and this is a very nice book. I hope you can see this book. I will read the name of the book. The name of the book is Treasure Works, John Henry Clark. And this book is written by Dr. Himanshu Tiwari. Dr. Himanshu Tiwari is a very well-known author. And of course, I have not met him personally. I do wish to meet him personally sometime. But I have read his other book also, where he has written about cancers. There's a very nice book about where he has compiled different writings. So basically, Dr. Himanshu, the great work that he does is he compiles many things, past all pioneers' writings and literature. So that's really wonderful. So I think people should buy this book. And mostly Clark's contribution to homeopathy is great. But I think we don't have any literature where compilation is there. So this is a wonderful book by Dr. Himanshu Tiwari. So I'm going to read something, what Clark says. In the introduction chapter, he's talking about kinds, degrees, and different grades of similarity. There's a topic, kind, degrees, and different grades of similarity. And he's talking about similarity of drugs. Now see what he says. It's so interesting. I think every newcomer should listen to this. As newcomers, many homeopaths in the beginning of their career apprehend about whether they will be able to find the most similar drug or not. Now, what is the similar drug? This is what is called constitutional remedy. So when the word constitutional remedy comes, the idea behind constitutional remedy is that we need to find the drug which is the most similar, matching everything, the remedy for the patient. That is called constitutional remedy. That is the meaning of constitutional drug, basically. So whether they will be able to give relief to the patient or not. Now, this is the very valid question and important question in newcomers, especially. Here, Clark assures the young homeopaths that instead of getting scared of high ideals, they should try to find the best possible simillimum, which is going to benefit the patient in some way or the other. So there are high ideals. When you say constitutional remedy, you are putting a lot of ideals in your mind about the remedy. So Clark is saying, don't worry about these high ideals. Just find the similarity and give whatever you can give at the time of, in the beginning. So they should try to find out the best possible simillimum, which is going to benefit the patient in some way or the other. He says now very important, he says, no two cases are exactly alike. He must be prepared to adapt his means to any case that may arise. And happily here is in homeopathy scope for the exercise of great variety of talent. In most cases, there are more remedies than one that will benefit. Now, this is so interesting. He says, in most of the cases, it's not that one remedy will benefit. There are many remedies given to the patient can benefit. So our idea about constitutional remedies, only constitutional remedy will work. And the remedy which works is constitutional. That is our idea. But he says nothing about that. He says in one condition, there may be, in most cases, there may be more than one remedy that will benefit. And if the exact similar is not found, if the exact similar is not found, the next that will give a great measure of relief or help to the patient. So the beginner need not abandon the ideal as too difficult to attain. So don't worry about the high ideals and finding the remedy, and don't worry about this. Clark is saying. Then now he says very nicely, it's a very important thing he says. Then there are many different kinds of similarities as well as of degrees. What are those? Because our homeopathic remedies work on two important principles. One is similarity and individualization. There are many different kinds of similarity as well as of degrees, and every kind is available for the prescriber's use. There is similarity between drug, anti-disease in organ affinity, in tissue affinity. There is similarity in diathesis, similarity in sensation and conditions. All these other kinds and other kinds of likeness are available for the prescriber to find his correspondence in. He is no friend of Hahnemann or of Hahnemann system who will tie up the practitioners to any one of them. Now, this is so interesting. What he is saying is that if there is a system, if somebody is following some system, or there's a physician who's teaching their students, and they're tying up people in one system, like somebody is an advocate of organopathy, somebody is advocate of mental system, somebody is advocate of some other system, and he ties his audience, his students, in one method. Or even if he is not tying, but if we are following some system and unintentionally we become a fanatic about that system, and we feel in our mind that if I follow this steps, then only I will reach to the remedy, and this is the only way I reach to the remedy, the constitutional remedy. So in my experience, I told you, right, I'm not the genius of, like, I don't hold I'm not an authority of organoid, right? But whatever little knowledge I have gained, hardly I have found this constitutional remedy, the word of constitutional in organon of medicine. So what is this idea of constitutional remedy? In my understanding now, what I want to explain is, as Clark says, I 100% agree with him. There are many remedies that can work and many ways of similarities are there. The idea is to find out the best similar remedy. Now, when we say best similar remedy, what does best similar remedy means? There are so many philosophies, there are so many methods in homeopathy that when you listen to somebody and their philosophy looks, wow, this is great. You listen to somebody else, wow, this is great. So you feel this method, if I follow and reach to the remedy, then only the remedy is right. Others say, hey, if I follow this way of thinking, then I reach to the remedy, that is right. I have no issue with any of the methods. I myself have learned many methods. But now I'm going to tell you something very interesting, very important one. By any way, any method you come to a remedy, any method. Remember, my friends, the real authority of selecting a drug is your materia medica. You use any method and come to a remedy, and you feel I should give this. Don't give it until and unless, listen to me carefully, until and unless the symptoms that you're prescribing on is written in materia medica, the classical books, Allen's, Borick, Clark, or many others. So if you can't find the symptom of the patient written in the materia medica, at least in bold, especially in bold, italics, underlined, if not The three are important: the bold, italics, and underline. If this is not there, at least it should be written in the generalities or the particular chapter or somewhere in the modality or in relationships. Somewhere the symptoms has to be written. When you find that, then your confidence, then you are confident, and then only remedy acts. This is my personal experience. I have got many cases back to back. I can show you where remedy has worked miraculously only when I could locate the symptom in the mater medica. Now, it could be any way. It could be toxicological way. It could be pathological way. It could be keynote way. It could be mental symptoms. It has to be written in the mater medica. We have to look and find out in mater medica. So this question of giving constitutional remedy, many times we think of constitutional remedy, and the idea behind that is that we should have the mental picture of the patient. Too much we go into mind and thematics. A lot of themes and thematics come into picture just to find out the constitutional remedy. The idea that we have been given, endowed with, that we have to find the constitutional drug, and we are fighting, in that philosophy, going very hard. We are working on the patient, but ultimately we come up with the whatever understanding of patient we come up. Just watch. I'm not saying whether you're right or wrong, but just watch. You're understanding what you have got in the patient. Is it the real understanding, or it is too much analysis, too much thinking, too much interpretation? How do you know it is interpretation? When you press something very far, very hard, and you push, 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 and patient has to say something. That is called interpretation. So you have to check. It's not me. You have to check whether you are interpreting it or not. How can you get away from interpretation? The best way is Kant's philosophy. What does Kant say? Kant says, match the generals. The generals has to be matched. Too much specificity is not enough. The general symptoms has to match. Or if you're prescribing on organopathic level, then maybe exact tissue changes has to be matched. Also, third point, very important, is to find out the remedy. It is very crucial for you to go into the past. Go into the past and find out from where the disease started. What is the evolution of the disease? What diseases he has suffered from the past? These are the components that you take. Your modalities, then your general symptoms. So when you understand in this fashion the remedy, I think then you are very close to the similar. So this was my explanation regarding constitutional remedy, the question that people have. And I can just say this, especially for my students and my colleagues, this video I have made. I can just say, my dear friends, whatever way you are coming or repertory we are is exploring, this and that we are doing in search of remedy, please read Mater Medica. The remedies that you want to give, read the drugs, read the drug pathogenesis, read the drug, organ affinity, read the drug mental and characteristic general symptoms, and read from Allen's, Borick, Clark, Kent. These are 4-5 books. Of course, there are many other books, but these are 4-5 books which you should read, really read. And more you read, more insights you will develop slowly and steadily. Insights into practice in patients, in remedies also, it develops slowly and steadily as you read Mater Medica. More drugs you read, more understanding you have, and more things you start seeing in the patient. So that's a short video. I hope this topic, this lecture helps you to find out the answers, the questions that come in the mind. Homeopathy is a great science. Practice it. Let's come together and learn, and let's do some good homeopathy so that we can help the humanity. This homeopathy is, I get goosebumps, when I talk about homeopathy. What homeopathic medicines can do. Only thing is, we have to practice the right way. Don't get swayed away by the glamour. Be to the basic, pick up the basic books, listen to the people who talk basics, and you will shine in your practice. That's what is our goal. Thank you very much. Namaskar. Thank you.